Hello, PsychU community, and welcome to today's presentation. This is Stephanie Asper, and I'm joined by Dr. Fatima Sadat, who will be discussing digital interventions in psychiatry. Today's presentation is sponsored by Otsuka Pharmaceutical Development and Commercialization, Inc., and our speaker is a paid employee of OPDC. Fatima Sadat is a Medical Science Liaison for OPDC. She received her PharmD from Touro University in Vallejo, California. Before Dr. Sadat gets started, I'd like to take a moment to cover our objectives. Today, we'll discuss the challenges and limitations of mental health care in the United States and explore the potential role of digital technology for mental health care. So without further ado, I'll turn the presentation over to Dr. Sadat.
So let's begin by looking at the challenges and limitations of mental health care in America. So what does mental health illness look like in America? In 2016, SAMHSA conducted a survey revealing 1 in 5 Americans live with a mental illness. And unlike a lot of chronic conditions that start later on in life, mental illness starts young, with nearly half of chronic mental illness beginning by the age of 14, and nearly 2/3 by the age of 24. And the numbers are staggering when we look at specific disease states in the U.S., with 2.4 million people living with schizophrenia, 16 million living with depression. Depression is actually the leading cause of disability worldwide. Millions of Americans are also living with bipolar disorder and anxiety disorders, leading to $193 billion lost in earnings every year due to serious mental illness. And despite advances in care, there remain several barriers to access to optimal mental health care and face-to-face psychosocial interventions. These include transportation difficulties, maybe time constraints, and even costs. And in addition to the shortage of mental health professionals, there are patient-perceived barriers to psychotherapy. Again, cost, time constraints, and concerns around stigma. Language can also play a role and can also affect the communication and miscommunication affecting the mental health care process overall. So the shortage of mental health professionals has been a persistent concern for decades. On average, there's about 1 mental health care provider for every 536 individuals, which could contribute to why only 40% of patients with mental illness receive treatment within the past year. So when we take a closer look at the shortages to mental health care providers, we see it's not evenly distributed across the U.S. In Massachusetts, for example, it's 1 healthcare provider per 200 individuals, while in places like in Alabama, it's about 1 in over 1,200 individuals. So what we see is that rural and low-income areas are the most affected by these shortages. And when we get patients in front of a provider, there remain limitations to patient assessment. So what are we talking about? So when clinicians often ask individuals to provide retrospective summaries of their past, or typical experiences, and the clinicians are doing this to gain insight into how clinical populations think, feel, and function. Retrospective reports are the most common method of data collection in psychiatric settings and are the cornerstone of clinical research and practice. However, there are limitations because retrospective reports cannot capture dynamic processes, and they are asking individuals to recollect their experiences, which is quite susceptible to various memory problems and recall inaccuracies, especially when we're talking about individuals with serious mental illness. So in a study analyzing retrospective reports, 24 individuals with schizophrenia and 26 non-clinical participants use a mobile device to complete multiple real-time, real-place assessments daily over 7 consecutive days. And at the end of the week, participants were also asked to provide a retrospective report summarizing the same period. So when the researchers compared the data by the 2 methods, it showed that participants from both groups retrospectively overestimated the intensity of negative and positive daily experiences. Respondents also rely on partial recall and extensive inference strategies when asked to report on their daily behaviors and experiences. These strategies result in well understood but difficult to avoid biases. So summary estimates can't always accurately capture one's most intense or most recent episode. Therefore, it cannot be used to design tailored interventions to help people cope with personal challenges that occur in the moment. So what's the role or potential role of digital technology in mental health care? Digital technology may offer advantages in the assessment and management of mental illness. These technologies can support continuous health monitoring at both the individual level and the population level, encourage healthy behaviors to prevent or reduce health problems, support patients in their own chronic disease management. It can also enhance provider knowledge, maybe reduce the number of healthcare visits, and provide a personalized and localized as well as an on-demand intervention in ways previously we thought unimaginable, especially when we can rely on cell phones to deliver this technology. Mobile technologies are pervasive and they're moving interventions in the real world. These interventions are applied in the moment using technologies that people carry with them throughout the day. This real-time information allows for monitoring of adherence to provide the feedback and improve treatment adherence. The digital technologies really have the potential to improve the patient-provider connection. So most mental health care providers agree that providing a comprehensive health care to individuals with serious mental illness involves more than pharmacological treatment, and that access to psychosocial supports are critical for promoting recovery and improving these individuals' lives. There is also growing consensus on the broad range of evidence-based psychosocial supports, for example, cognitive behavioral therapy, motivational interviewing, or ACT teams. And despite the agreement, though, many such supports are either unevenly applied or completely inaccessible with individuals with serious mental illness. For healthcare stakeholders, the challenge has become less about identifying the best practices, but rather implementing a continuum of available, effective practices and ensuring that these are both accessible and sustainable. So digital psychosocial interventions may potentially address some of these barriers to the face-to-face psychosocial interventions and expand access to treatment. Technology really offers the opportunity to increase patient access and service recipients limited by maybe geographical location, a medical condition, a psychiatric diagnosis, and can offer high-quality psychosocial service through the use of technology. So digital technology really has the potential to bring specialty services to the fingertips of clinicians. Technology facilitates the delivery of psychological services by new methods, maybe online psychoeducation, therapy delivered by an interactive interface, and augments traditional in-person psychological services. So because mental health is fluid, just like our physical health, and early intervention is key, digital technologies provide new tools for assessing and managing mental health. For example, mobile health or mHealth sensors are convenient since most people own a cell phone and can monitor several behavioral indicators of mental health. There are digital assessment tools, personalized health records that can aid in the shared decision-making process. There are about 800 mental health apps available, and one study found that about 75% of individuals would be open to using a mental health app. The app can include treatment components such as cognitive therapy, behavioral activation, psychoeducation, and monitoring of symptoms. And we know, of course, that adherence is an issue for individuals with serious mental illness. One study found that 75% of patients with schizophrenia become non-adherent within 2 years of hospital discharge. So a lot of the technologies are focusing on medication adherence. And then, of course, telepsychiatry has become more widely available and can help individuals in rural areas. So what does technology look like in the United States? Well, Americans are increasingly connected to the world of digital information. A study of over 2,000 adults in 2018 found that 89% of them use the internet, and 95% of them have a cell phone, and most of these are smartphones. Along with mobile phones, Americans own a wide range of other information devices. Nearly 3/4 of U.S. adults now own a desktop or laptop computer, while roughly half own a tablet computer. And there is widespread use of digital devices in the seriously mentally ill. A 2014 survey of psychiatric outpatients across 4 U.S. study sites found 86% had a cell phone, and most of them being smartphones, and 71% expressed a willingness to use a mental health app. And while many patients diagnosed with serious mental illness use digital technology on a daily basis, there are still remains a minority of individuals who are digitally excluded and they need education to bring them to the forefront. So what does digital technology look like in patients specifically with psychosis? A large meta-analysis of 15 studies with psychiatric patients in 2015 found that in a subgroup of patients with psychosis, 66% owned a mobile phone, while 57% reported daily use of a mobile device. But interestingly enough, there is a trend of increased ownership. So patients with psychosis within the past 2 years who were surveyed, now 81% of them own a mobile device. And many respondents indicated that they'd be interested in an mHealth service type delivery on their mobile phone. And this included tracking or monitoring their mental health, receiving information about physical or mental health, receiving reminders to take their medication. So it can really facilitate that connection between the healthcare provider and patient. So the application of digital technology to mental health care is poised to become the fourth major wave of evolution in psychiatry, which began in about the late 19th century and saw the advent of psychotropic drugs in about the 1950s. In the 1980s and 90s, we saw the adoption of evidence-based practice, for example, clinical decision-making based on the best available research and clinical expertise of care for individual patients. Since the early 2000s, there has been a growing interest in the application of digital technologies to psychiatric practices. But despite the use of psychopharmacology, there still remains suboptimal treatment response, and residual symptoms remain a concern for individuals. The use of digital technology may have the potential to overcome some of these issues related to access to mental health care. Thank you for joining us for part 1 of Digital Interventions in Psychiatry. My name is Dr. Fatima Sadat, Medical Affairs from Otsuka Pharmaceutical. Please stay tuned as we bring you part 2 of Digital Interventions coming to PsycU soon.